The risk of dementia is something that many of us consider as we grow older. But have you ever thought about how certain medications might play a role in speeding up memory loss or cognitive decline? You'd be surprised to learn that some of the most commonly used medications, from antihistamines to sleep aids, might be quietly affecting your brain health. It's not all doom and gloom, though. By staying informed and making small adjustments, you can protect your brain for the future. In today's video, we'll dive deep into 10 common medications that have been linked to an increased risk of dementia. I'll also share practical tips and real-life stories to help you make better decisions for your health. If you've been taking any of these drugs for a while, or are simply curious about how your everyday pills might affect your brain in the long term, stick around till the end for some crucial insights and recommendations. And remember, always consult your doctor before making any changes to your medications. 1. Anticholinergics, the silent brain drainers. Anticholinergic medications, such as Benadryl, diphenhydramine, are widely used for common issues like allergies, motion sickness, and insomnia. These drugs work by blocking acetylcholine, a neurotransmitter that is vital for memory and learning, but long-term or high-dose use can negatively impact memory, especially in older adults. I once treated a patient, an elderly woman named Clara, who had been using Benadryl regularly for sleep for over 10 years. Over time, her family noticed that she was becoming increasingly forgetful. After switching her to a non-anticholinergic alternative, her memory improved significantly. This story is a reminder of the importance of exploring medication alternatives when we notice subtle cognitive changes. 2. Benzodiazepines, anxiety relief that might cost you memory. Benzodiazepines like Xanax, alprazolam, and Valium, diazepam, are commonly prescribed to manage anxiety or insomnia. However, their long-term use, particularly in older adults, can lead to memory problems, confusion, and even falls. This is because these medications linger in the body longer as we age, causing sedation and impairing cognitive function. Take the example of John, a 65-year-old man who had been using Xanax for anxiety for nearly 15 years. He found himself increasingly forgetful and disoriented, especially when trying to remember simple details like appointments or where he put his keys. After working with his doctor to find safer alternatives, such as therapy and relaxation techniques, John experienced improved mental clarity. 3. Z-drugs, non-benzodiazepine sleep aids. Zolpidem, Ambien, a common non-benzodiazepine sleep aid, works similarly to benzodiazepines but with potentially fewer side effects. However, extended use still poses risks such as memory problems and confusion. I had a patient, Susan, who struggled with chronic insomnia and was prescribed Ambien. After a few months, her husband noticed she was having trouble recalling details about conversations they'd had earlier that day. It wasn't until she switched to cognitive behavioral therapy for insomnia that her memory returned to normal. This experience underlines the importance of exploring non-drug solutions for sleep issues. 4. Proton pump inhibitors, PPIs, heartburn drugs that may harm the brain. Proton pump inhibitors, PPIs, like Nexium, esomeprazole, are commonly used for acid reflux and stomach ulcers. However, studies suggest that long-term use of PPIs may be associated with an increased risk of dementia, potentially due to their impact on vitamin B12 absorption and gut bacteria balance. In my clinical practice, I've seen several older adults who have been on PPIs for years. One particular case was Bob, a 70-year-old patient who experienced both memory lapses and severe vitamin B12 deficiency after prolonged PPI use. When he switched to a different acid reflux treatment, his cognitive function improved. It's important to assess whether the benefits of these medications outweigh the risks, especially in older individuals. 5. Tricyclic antidepressants, helping depression, but at what cost? Tricyclic antidepressants, TCAs like amitriptyline and imipramine, are effective for treating depression and chronic pain. But they also have anticholinergic effects that can impair memory and cognition. Over time, these medications can cause confusion and brain fog, particularly in older adults. I recall a patient named Linda, who had been taking amitriptyline for years to manage her chronic pain over time. She noticed her memory wasn't as sharp, and she became more easily confused. After switching to a newer class of antidepressants with fewer cognitive side effects, she felt much more alert and mentally clear. It's important to review your medications periodically to ensure they are still the best choice for your health. 6. Antipsychotics. Medications for mental health, but risky for the brain. Antipsychotic drugs like risperidone, Risperdal, and olanzapine, Zyprexa, are often prescribed for conditions like schizophrenia or bipolar disorder. However, in older adults, these medications can worsen cognitive decline and may lead to serious side effects, particularly for those already diagnosed with dementia. In one of my cases, a patient named Thomas, who was diagnosed with schizophrenia, was prescribed risperidone. Over time, his family noticed significant cognitive decline, which worsened his behavioral symptoms. After discussing with his doctor, they reduced the dosage and switched to a different approach for managing his symptoms. It's critical to keep an eye on any mental or cognitive changes if you or a loved one is using these medications. 7. Statins. Cholesterol-lowering drugs with potential side effects. Statins like Lipitor, atorvastatin, and Zocor, simvastatin, are primarily used to lower cholesterol and prevent heart attacks or strokes, which are themselves risk factors for dementia. While these drugs are essential for heart health, some individuals report feeling mentally foggy or forgetful after starting statin therapy. I've had patients, including one named Gerald, who complained of memory issues after starting statins. After adjusting his dose, his cognitive function improved. The lesson here is that if you're on statins and notice any memory issues, don't stop the medication abruptly. Instead, discuss with your healthcare provider about possible adjustments or alternatives. 8. Anticonvulsants. Seizure medications with brain fog. Side effects. Medications like phenytoin and topiramate, which are used to control seizures, can sometimes cause cognitive problems, particularly when used over long periods. The higher the dose, the more likely it is that the person will experience brain fog or slowed thinking. One patient I treated, a middle-aged woman named Karen, was using phenytoin for seizure management. After years of use, she began to notice difficulties with her memory and processing speed. By adjusting her dosage and exploring alternative treatments, we were able to mitigate the cognitive side effects while still managing her seizures effectively. 9. Antihypertensives, blood pressure, medications, and cognitive function. Certain blood pressure medications, like beta blockers, can cause fatigue and mental sluggishness in some people. While keeping blood pressure in check is vital to prevent strokes, which can lead to vascular dementia, it's equally important to monitor how these medications impact cognitive function. One patient of mine, Susan, had been on a beta blocker for years to control her hypertension. She began to notice that she was feeling more forgetful and mentally drained after working with her doctor. They found a blood pressure medication that didn't affect her memory and energy levels as much. 10. Over-the-counter sleep aids. Easy to overlook, but not without risks. Many over-the-counter sleep aids like Tylenol PM and Advil PM contain antihistamines that can cause drowsiness. While they may help you sleep, using them too frequently can lead to confusion, daytime drowsiness, and memory problems, particularly in older adults. A friend of mine, Emily, had been using Tylenol PM regularly for sleep. After several months, she began to experience daytime grogginess and trouble recalling things from the previous day. When she stopped using the sleep aids and focused on improving her sleep hygiene, her memory and energy levels improved significantly. It's essential to remember that just because a medication is linked to cognitive decline doesn't mean it will cause dementia in everyone who takes it. However, being proactive and discussing these concerns with your doctor is a wise approach. Whether it's reducing your medication dose, trying an alternative treatment, or incorporating lifestyle changes, there are steps you can take to protect your brain. As we age, our bodies change, and medications may affect us differently than when we were younger. Staying informed, actively reviewing your medications, and exploring non-drug treatments when possible will go a long way in maintaining your cognitive health. If you've learned something new today, be sure to like, share, and subscribe. The more we talk about these issues, the better equipped we are to make healthier choices for our future. Remember, it's never too late to make changes that benefit your brain health.